Some children are born with a cut lip or a hole in the roof of the mouth. This is a very common birth defect. But in the hands of a good surgeon, it can be fully corrected, and that too totally free. The hole in the roof of the mouth may not be visible from outside, but must be closed. If not done at the right age, this will prevent the child from speaking properly when he grows up. There may also be other problems such as milk and food coming out of the nose, as well as repeated bouts of cough and cold and other chest and ear infections, making the child fall sick frequently. The only way to close the hole in the roof of the mouth is through surgery. And to make the child fit and strong for that surgery, they need to be fed adequately. Mother's milk is like nectar for the child. There is no food better for the child than mother's milk. But because of the hole in the roof of their mouths, many such children are not able to take in milk properly. Instead, they suck in a lot of air. And even though they feel full, they haven't received adequate milk. Sometimes, it comes out through the nose or could even go into their lungs. Because of the extra effort, many children tire easily and fall asleep. And the mother feels the child has taken the full feed and gone to sleep. In this video, we will show mothers how to feed such children. The best ways to feed the child directly from the breast. For this, the mother needs to hold the child upright so that the milk goes into the stomach instead of coming out through the nose or go into the lungs. The nipple should be directed towards the side of the mouth that does not have a cut. Since the baby is not able to suck with enough force, the mother should simultaneously squeeze her breast to increase the flow of milk. But do this gently. Sometimes these children may not be able to swallow the milk if it comes too fast, and some of it could come out of their mouth. If this happens, stop and slow down. With a little practice, the mother and child can set a flow rate that the child can handle, and both will soon adjust to one another. These children also suck in a lot of air as they are taking in the milk and need to be burped more often. For that, put the baby on your shoulder and gently rub his back down up until you hear a burping sound. This needs to be done a few times during feeding and at the end of feeding. If for any reason feeding from the breast does not work, the mother can also expel her milk from the breast into a container and feed with a spoon or through a bottle. Special feeding containers are available at some places, and these can be used. Or you can enlarge the hole in the teat of a feeding bottle to increase the flow of milk. The mother must make sure the container, spoon, and bottle are clean and sterilized. For this, they must be kept in boiling water for at least 10 minutes. Feeding through unclean containers, spoons, and bottles can lead to infections and fever. If the mother is simply unable to feed her own milk for any reason, the next best thing is to give cow's milk or formula milk. This is clearly not the best, but if mother's milk is just not available, the child can be fed with these. It is very important that the cow's milk is pre-boiled and cooled, and then fed with a spoon or through a bottle. It should never be diluted. If using formula milk from a tin, make sure the water used is absolutely clean and preferably boiled. After boiling the water, let it cool before mixing with the powdered milk. Make sure the proportions of powdered milk in water is exactly as recommended. Feeding dilute milk will not give the child the nutrition needed to become fit for surgery. It is worth repeating. Please make sure all containers, spoons, and bottles you use are clean and sterilized. If the child is just unable to take any form of milk, he should be started on soft food and cereals as early as possible. But for this, you must consult a doctor without any delay. How will you know if the feeding is going well and the child growing normally? The easiest way is to take the child to the nearest center regularly for a checkup. But if that is not possible, you should regularly monitor the baby's weight. Keep a record and show it to the doctor. All such visits Center are totally free. Once the child is old and strong enough to undergo surgery, the doctors will once again carefully examine the child and advise when to come to the hospital. Please follow their advice. They know best. Remember, the entire treatment from the first visit right through surgery and follow-up treatment will be totally free. And after treatment, your child will become like any other child, have a perfectly normal childhood, and grow up into a fine young adult. Takes care of hundreds of thousands of such children around the world every year. But this would not be possible without the mother's cooperation. Please persevere and have patience.
Mang trong con tim nồng nàn tình yêu trẻ thơ, là hoa xinh tươi rạng ngời ngày sau. Và cầu mong cho em có một cuộc đời vui ấm no, tình yêu thương chan chứa mãi muôn đời. Như ngôi sao băng lạc vào thần tiên ước mơ, tặng em những chiếc cầu vồng xinh xinh. Nụ hoa mang hương thơm bay vào dòng đời bao trẻ thơ, và mong sao em sẽ hết